Well, mostly get a lot of back pain. A lot. It's been going on for about 7 years, probably consistently now. A lot of stiffness in the upper, around the neck area, shoulder blades, kind of. Every once in a while, I'll get some spasms in the lower areas, and it kind of radiates sometimes, and it kind of moves, seems like, in certain areas. But over the last, say, a couple of months now, it's like the pain has gotten a little worse. Usually in the mornings, it's really stiff. Got to sit on the side of the bed for like maybe 30, 40 seconds before I stand up and stretch everything. And throughout the day, because I stand up a lot at work, I don't sit down a lot because the chair's not that good anyway, but I stand up a lot. By the end of the day, a lot of the pain kind of subsides a little bit, but I still feel it, and there's still a lot of stiffness there still. And it just kind of depends on certain days what's going on throughout the day. But
so when you wake up, it's pretty bad?
Yeah. Okay. The mornings is,
Can you show me where it bothers you when you wake
usually
up?
in the mornings, I feel it in this area, down here, right in that area.
Okay.
Yeah.
So through here and also through here?
Yeah.
Okay. Are there emotions right now that actually hurt? When you,
Emotions?
yeah. When you move your neck, or do you just feel it in the morning?
Yeah, it does. Certain angles.
Okay, what angles hurt? Can you replicate it right now?
I turn it sometimes this way or this way. I can feel the tension in here. Yeah, a little bit.
So when you turn all the way right now, do you feel it?
Yeah. Now my whole leg's up or down.
So go as much as you can until you start feeling the pain.
Right there.
Where do you feel it?
Down. About right there.
Okay.
And I feel it more when I go down. It's usually in this area.
Okay, so here we're going to look at Troy's lateral. Usually the first thing we look at when we're looking at especially hot lower backs. Okay, so just looking really quick at his x-rays. Okay, even though we're noticing a lot of wearing away all throughout, this just means there's been a long-standing problem, right? These bone spurs and the osteoarthritis that's happening here. We really want to find where that disc is swollen and posterior. Rather the vertebra is posterior, right? Pinching into the nerve. Okay, so right here we see that there's a pretty relatively parallel. They're not parallel, but they're more parallel than L5S1, right? And we see a lot of posteriority happening over here at the L5 area. Okay, so that's my prime candidate when we look at Troy, and that's probably where I would look to see if that level right here where the nerve exits correlates to my nervoscope readings. So Troy also complains of shoulder pain as well as neck stiffness. So here we're going to look at his lateral, but especially with regards to the flexion extension films, or what we call motion studies. So over here, we can notice that he's completely lost the curve over here. Okay, but we're really looking for what's posterior. Now, T1 definitely looks like a candidate here, but let's take a look at the flexion extension. Okay, so so definitely over here, the T1 is definitely not flexing forward. Okay, so we can see, just really quick, that we can see that a lot of these are flexing forward except for T1, right? So that would definitely be a prime candidate, and this is when he extends back, right? So this definitely points to a T1 problem, so that would be my prime candidate, at least from a structural standpoint. Of course, we still need to correlate it to what we find on the actual patient. We're obviously going to do our scope readings as well as palpation as well to confirm that that's the one I'm going to be adjusting. So this instrument that we're using right here, Troy, it's just detecting if there's any heat differentials. So I am marking on your back, by the way, so if you see green marks, that's me. I'm just feeling the joints right here. So we're going to adjust over here, right, Joyce? So I'm going to show you what I'm going to do before I do it, okay? So, what I'm going to do is I'm going to be pushing this joint forward, okay? I'm not going to be like twisting your head or anything like that, okay? I'm just going to push it forward. I just need you to relax your left shoulder a little bit, and I'm going to give this a little push, okay? Just relax.
Wow.
You right? You alright?
Yeah.
Alright. So, let me show you what I did. What I did was I adjusted this joint over here, right, and I pushed this forward. You have a really big reversal into there, right? So we really want to start working on the bottom to pivot that to start pulling back. I'm going to just move it a little bit and see how. What do you feel?
Feel the difference, yeah. Feel the difference, yeah.
Okay.
Yeah.
Good. Okay. What do you feel? Do you feel more range of motion?
A little bit more motion, yeah. Not as tense, not as tight, intense there.
Awesome.
Yeah.
Good stuff.
A lot of looser. I feel like it would turn my head and stuff.
Awesome. Wow. We have more to go. We're just getting started. Right here is what we're going to adjust. So I'm going to roll you a little bit here. Okay? Put my hip here. Better. Okay. Good. Not too bad, man.
Yeah.
Good. Tell me, Troy, again, I guess, what movements you can do and all that stuff.
Yeah,
So,
as I was planning with Dr. Jerry, prior to his first initial treatment adjustment, I was having some lower back pain at the very lower part of my back, or the spinal area, and a lot of times I'd have to get up in the morning, sit on the side of the bed like I am now, and stretch over like I'm touching my toes from here for about 30 seconds or so before I was able to get up comfortably without feeling any tightness or pain. And since the initial treatment, I mean, just that one treatment, I don't even feel the pain anymore. I couldn't even jump up and down like in place or jog without feeling like someone was kicking me or hitting me in the lower back. And since that one adjustment, I don't even feel the pain anymore. It's amazing.
awesome, man.
Yeah. Oh, and I also noticed I'm not leaning that much on my right side anymore. I'm leaning a lot on my right side. I stand up at work, and I noticed when I was standing flat-footed, I wasn't leaning more to the right anymore as well.
Good, man.
Yeah.
Awesome.
Yeah.